In my previous video, I had explained the anti-diabetic actions of metformin, and today I am going to talk about the multiple additional benefits of metformin and the clinical uses of metformin. Type 2 diabetes mellitus is a complex disease associated with increasing risk of pathological conditions such as obesity, metabolic syndrome, non-alcoholic fatty liver disease, atherosclerotic heart diseases, dementia, certain types of cancers, neurodegenerative diseases and other complications. Metformin is a first-line medication for the treatment of type 2 diabetes mellitus. However, growing evidence suggests that metformin, when added to standard therapy, inhibits or delays the progression of all of these conditions mentioned just now. So metformin not only acts as a glucose-lowering drug, but it has additional benefits. So firstly, I will be talking about the pleiotropic effects of metformin, and then I'll give you 6 clinical uses of metformin besides its use in type 2 diabetes mellitus. So let's look at the benefits of metformin. Metformin not only acts as a glucose-lowering drug, but it also helps to lower the insulin resistance and decreases hyperinsulinemia. Secondly, metformin also regulates lipid metabolism. It increases the fatty acid oxidation in the liver, decreases the release of free fatty acids into the circulation, and decreases the damaging lipoproteins such as LDL, VLDL, and increases the cardioprotective lipoproteins such as HDL. In addition, metformin also has anti-inflammatory and antioxidative effects. Metformin suppresses inflammation by reducing the release of pro-inflammatory cytokines and increasing the synthesis of anti-inflammatory cytokines. Metformin also inhibits chronic inflammation indirectly by improving the insulin sensitivity in various target organs such as liver, skeletal muscle and adipose tissue, and also improves the pancreatic beta cell function, corrects diabetic dyslipidemia, and helps in reducing inflammation and acting as an anti-inflammatory agent. The antioxidant effect of metformin is due to a reduction in oxidative stress and strengthening the antioxidant defense mechanisms. Chronic hyperglycemia is known to induce oxidative stress, increases the generation of free radical formation, and the reactive oxygen species causes injury or apoptosis of the pancreatic beta cells, causing secretory dysfunction and leading to the development of diabetes mellitus. So these are the multiple benefits of metformin. So let's move on to the clinical uses of metformin. Metformin is approved and is commonly used for the treatment of type 2 diabetes mellitus. But in addition to diabetes mellitus, it is often used off-label in the treatment of several other clinical conditions because of its multiple benefits. So now let's discuss 6 clinical uses of metformin. So the first one, metformin is commonly used in a pre-diabetic individual and in obesity. As we know that obesity is associated with insulin resistance, and the metabolic consequences of insulin resistance is development of type 2 diabetes mellitus and progression of atherosclerotic cardiovascular diseases. So metformin, by improving insulin sensitivity in various target organs such as liver, skeletal muscle and adipose tissue, improve glucose utilization in various tissues. By normalizing blood glucose level, it also helps in improving the pancreatic beta cell function. It also helps to correct lipid metabolism disturbances. Metformin helps to correct carbohydrate and lipid metabolism disturbances, and this prevents or delays the development of diabetes and its complications. The second use of metformin is type 1 diabetes mellitus. Metformin is often used as an add-on therapy to insulin in the treatment of type 1 diabetes mellitus. This is because metformin reduces insulin resistance, improves or enhances insulin action, and this helps in reducing the insulin dose requirements. So insulin dose requirements are reduced, insulin sensitivity is improved, the glucose utilization is improved, and this is particularly useful in young diabetics with obesity. The third use of metformin is gestational diabetes mellitus. An advantage of metformin over other oral hypoglycemic drugs is its increasing use in the treatment of glucose metabolism disturbances in pregnancy. Numerous clinical trials indicate that metformin is an effective, safe and cheap option in the treatment of gestational diabetes mellitus in a mother and type 2 diabetes mellitus in pregnancy. So this helps in improving the maternal and perinatal outcome. Also, it is important to note that metformin is classified as category pregnancy B. So if there is a clinical need, it is considered to be safe. In contrast, the other oral hypoglycemic drugs are classified as category pregnancy C drug. So these drugs are completely avoided in pregnancy, unlike metformin, which is considered to be safe in pregnancy. The fourth clinical use of metformin is polycystic ovarian syndrome. Metformin is the only antidiabetic drug that is used in polycystic ovarian disease. So what is polycystic ovarian syndrome? It is an endocrine disorder which is characterized by increased insulin resistance, because of which there is metabolic derangements, metabolic syndrome. Also there is increased level of androgens, and this causes hirsutism, infertility, menstrual irregularities. So metformin is useful in the treatment of polycystic ovarian disease by improving the insulin sensitivity, correcting the metabolic derangements, controlling and regulating the menstrual cycle, improving the rates of fertility, and therefore this is used as an add-on to other treatment options in polycystic ovarian syndrome. The fifth clinical use of metformin is its use in non-alcoholic fatty liver disease. A high proportion of type 2 diabetes mellitus have non-alcoholic fatty liver disease, and both these conditions are associated with obesity, and this increases the risk of cardiovascular events. So metformin is useful in the treatment of non-alcoholic fatty liver disease by decreasing the hepatic lipid synthesis, reducing the accumulation of triglycerides, reducing inflammation in the liver, decreasing the oxidative stress and correcting the metabolic derangements. Therefore, metformin is particularly preferred in type 2 diabetes mellitus patients with non-alcoholic fatty liver disease and obesity. The sixth clinical use of metformin is cardioprotection. Unlike sulfonylureas, which is reported to increase the risk of cardiovascular events, metformin has better cardiovascular safety profile. So metformin is known to improve insulin sensitivity in cardiomyocyte, improves glucose utilization by the cells, and this helps in switching the metabolism from lipid to glucose, which is a more efficient fuel. Secondly, metformin is also known to have antioxidative effect. So it promotes endothelial integrity, increases the synthesis of nitric oxide and endothelium-derived relaxing factor, and reduces oxidative stress. Thirdly, metformin is also known to suppress inflammation by normalizing glucose and lipid metabolism and also correcting metabolic derangements, reducing the synthesis of pro-inflammatory cytokines and increasing the synthesis of anti-inflammatory cytokines. So by reducing inflammation, decreasing the oxidative stress, correcting metabolic derangements, metformin offers protective cardiovascular effects. So a quick recap on the clinical uses of metformin. Metformin is approved for the treatment of type 2 diabetes mellitus. The other uses of metformin are obesity, type 1 diabetes mellitus, polycystic ovarian syndrome, non-alcoholic fatty liver disease, cardioprotection, gestational diabetes mellitus. So thank you for watching. If you find my video useful, please like and subscribe to this channel.